Hello my friends, and welcome back to my channel. My name is Nikolai Ninev, and I am a certified food expert and pharmacist. Today's video is all about Serrapeptase, a proteolytic enzyme gaining popularity for its potential benefits. In this video, I'll be delving into the topic and uncovering everything you need to know about Serrapeptase, its benefits, dosage, and safety concerns. So, let's get started. What is Serrapeptase, and what are the potential benefits of using it? Serratia marcescens, also known as Serratia E15, is an enterobacterium that produces the proteolytic enzyme Serrapeptase, also known as Serratiopeptidase. This microorganism was originally isolated from silkworm intestines. It has gained popularity as a natural supplement due to its potential health benefits. This enzyme works by breaking down proteins into smaller fragments called peptides, which makes it useful for various therapeutic purposes. Serrapeptase is commonly used as a dietary supplement and is available in capsule or tablet form. One of the primary mechanisms of action of Serrapeptase is its ability to reduce inflammation. It does this by inhibiting the release of certain inflammatory molecules and enzymes in the body. By reducing inflammation, Serrapeptase may help alleviate symptoms associated with inflammatory conditions such as arthritis, sinusitis, and bronchitis. In addition to its anti-inflammatory properties, Serrapeptase has been found to have analgesic effects, meaning it can help relieve pain. It does so by blocking the release of pain-inducing compounds in the body. This makes Serrapeptase a potential option for individuals experiencing chronic pain, such as those with arthritis or fibromyalgia. Serrapeptase also exhibits fibrinolytic activity, which means it can dissolve blood clots. It breaks down and removes excess fibrin, a protein involved in the formation of blood clots, thereby promoting better blood flow. This property of Serrapeptase has led to its use as a potential therapy for conditions related to blood clotting, such as deep vein thrombosis and cardiovascular diseases. Moreover, Serrapeptase has shown promise in managing chronic respiratory diseases. It can help reduce mucus production and thin out mucus, making it easier to clear the airways. This makes Serrapeptase a potential adjunct therapy for conditions like chronic obstructive pulmonary disease, bronchitis, and asthma. One of the main benefits of Serrapeptase is its ability to reduce inflammation. Inflammation is a natural response by the body to injury or infection, but chronic inflammation can lead to various health problems. Serrapeptase has been shown to help reduce inflammation by breaking down proteins that contribute to the inflammatory response. By reducing inflammation, Serrapeptase may help alleviate symptoms associated with various inflammatory conditions, such as arthritis, sinusitis, and bronchitis. This makes Serrapeptase a potential natural alternative to nonsteroidal anti-inflammatory drugs for managing inflammation-related conditions and pain relief. According to one study, Serrapeptase causes effects similar to those of cyclooxygenase 1, COX-1, and cyclooxygenase 2, COX-2, inhibitor drugs, like nonsteroidal anti-inflammatory drugs. This study also shows that Serrapeptase dissolves dead and damaged tissues caused by inflammation, commonly seen in respiratory issues like sinusitis and bronchitis. Researchers also concluded that Serrapeptase was more effective at improving lockjaw than ibuprofen and corticosteroids, which are powerful drugs that tame inflammation. Serrapeptase has been studied for its potential to reduce inflammation in several clinical trials. For example, a study found that Serrapeptase significantly reduced swelling and pain in patients with ear, nose, and throat disorders. Another study showed that Serrapeptase reduced inflammation and improved symptoms in patients with chronic airway diseases. It is believed that Serrapeptase inhibits the release of certain inflammatory mediators and promotes the breakdown of excess fibrin, a protein involved in the formation of scar tissue and inflammation. By reducing these factors, Serrapeptase helps modulate the inflammatory response in the body. It's important to note that, while Serrapeptase may help reduce inflammation, it should not be used as a substitute for medical treatment. If you are experiencing chronic inflammation or have a specific medical condition, it is always best to consult with a healthcare professional before starting any new supplement or treatment. Serrapeptase has been studied for its potential to prevent infections. It works by breaking down proteins and reducing the formation of biofilms, which are protective layers that bacteria can form to evade the immune system and antibiotics. This biofilm acts as a shield against antibiotics, allowing bacteria to grow rapidly and cause infection. By disrupting biofilms, serrapeptase may help prevent the growth and spread of bacteria, reducing the risk of infections. However, it's important to note that more research is needed to fully understand the effectiveness of serrapeptase in preventing infections and to determine the optimal dosage and duration of use. Some studies have shown promising results regarding serrapeptase's ability to prevent infections. For example, a study published in the Journal of Clinical Pathology found that serrapeptase was effective in reducing the formation of biofilms by Staphylococcus aureus, a bacteria commonly associated with infections. In fact, studies have shown that antibiotics are more effective when combined with serrapeptase in treating Staphylococcus aureus than antibiotic treatment alone. Another study published in the Journal of Microbiology and Biotechnology demonstrated that serrapeptase inhibited the growth of various bacteria, including Escherichia coli and Pseudomonas aeruginosa. These findings suggest that serrapeptase may have potential as a preventive measure against bacterial infections. Several other studies have suggested that serrapeptase in combination with antibiotics may be a good strategy to reduce or stop the progression of infection, especially from antibiotic-resistant bacteria. While serrapeptase shows promise in preventing infections, it's important to consider other factors as well. Viruses, fungi, and bacteria are just a few of the pathogens that can cause infections. Serrapeptase effectiveness may vary depending on the specific pathogen involved. Additionally, the dosage and duration of serrapeptase supplementation may also play a role in its preventive effects. It's worth noting that serrapeptase should not be used as a substitute for conventional medical treatments for infections. If you suspect an infection or are experiencing symptoms, it's important to seek medical attention and follow the advice of healthcare professionals. Serrapeptase may be considered a complementary approach to support overall immune health and potentially reduce the risk of infection, but it should not be relied upon as the sole preventive measure. Serrapeptase has been studied for its potential to dissolve blood clots. Blood clots can be a serious medical condition that can lead to complications such as heart attacks and strokes. Serrapeptase has been found to have fibrinolytic properties, which means it can break down fibrin, a protein involved in the formation of blood clots. By breaking down fibrin, serrapeptase may help dissolve existing blood clots and improve blood flow. Several studies have suggested that serrapeptase may be effective in reducing the size and severity of blood clots. For example, a study published in the Journal of Atherosclerosis and Thrombosis found that serrapeptase was able to dissolve blood clots in the arteries of rats. Another study published in the International Journal of Surgery Research and Practice reported that serrapeptase was effective in reducing the size of blood clots in patients with deep vein thrombosis. These findings indicate that serrapeptase may have potential as a natural alternative to traditional clot-dissolving medications, but further research is needed to confirm these effects in humans. Additionally, serrapeptase may not be suitable for everyone, especially those who are already taking blood-thinning medications or have a bleeding disorder. It is worth noting that serrapeptase is not a substitute for medical treatment for blood clots. Your healthcare provider can determine the most appropriate course of treatment, which may include medications, procedures, or other interventions to dissolve the clot and prevent complications. Serrapeptase should only be used under the guidance and supervision of a healthcare professional and should not be relied upon as the sole treatment for blood clots. Serrapeptase has also shown potential for managing chronic respiratory diseases and can be a potential option for individuals seeking alternative treatments. Chronic respiratory diseases, such as asthma, chronic obstructive pulmonary disease, COPD, and bronchitis involve inflammation and mucus production in the airways. Serrapeptase may help reduce inflammation, break down mucus, and improve respiratory symptoms in these conditions. By reducing inflammation, serrapeptase may also help alleviate symptoms such as coughing, wheezing, and shortness of breath. In addition to its anti-inflammatory effects, serrapeptase also helps break down and remove excess mucus in the respiratory system. This is beneficial for individuals with chronic respiratory diseases, as excessive mucus can obstruct the airways and contribute to breathing difficulties. By promoting mucus clearance, serrapeptase may help improve lung function and overall respiratory health. In one 4-week study, 29 people with chronic bronchitis were randomly assigned to receive 30 milligrams of serrapeptase, or a placebo daily. Bronchitis is one type of chronic obstructive pulmonary disease that leads to coughing and difficulty breathing due to the overproduction of mucus. People who were given serrapeptase had less mucus production compared to the placebo group and were better able to clear the mucus from their lungs. However, more research is needed to support these findings. It is important to approach serrapeptase as a complementary treatment and consult with a healthcare professional before incorporating it into your respiratory disease management plan. Following a comprehensive treatment approach and addressing the underlying causes of the condition remain crucial for optimal respiratory health. Serrapeptase has also been studied for its potential to curb pain in various conditions. It is believed to work by reducing inflammation, which is a common cause of pain. Inflammation occurs when the body's immune system responds to injury or infection, leading to swelling, redness, and discomfort. By targeting and breaking down certain proteins involved in inflammation, serrapeptase may help alleviate pain. Serrapeptase works by inhibiting the release of certain compounds that transmit pain signals in the body. This can be particularly beneficial for individuals with chronic pain conditions such as arthritis or fibromyalgia. Some studies have shown promising results regarding serrapeptase's ability to reduce pain. For example, a study published in the Journal of International Medical Research found that serrapeptase significantly reduced pain intensity in patients with chronic sinusitis, a condition characterized by inflammation of the sinuses. Another study reported that serrapeptase reduced pain and improved overall well-being in patients with carpal tunnel syndrome, a condition that causes pain and numbness in the hand and arm. One study looked at the effects of serrapeptase on nearly 200 people with inflammatory ear, nose, and throat conditions. Researchers found that the participants who supplemented with serrapeptase had significant reductions in pain severity and mucus production compared to those who took a placebo. These findings suggest that serrapeptase may be a potential option for managing pain in certain conditions. However, it's important to note that more research is needed to fully understand its pain-relieving effects and to determine the appropriate dosage for different conditions. What is the recommended dosage of serrapeptase? When taken orally, serrapeptase is easily destroyed and deactivated by your stomach acid before it has a chance to reach your intestines to be absorbed. For this reason, dietary supplements containing serrapeptase should be enteric-coated, which prevents them from being dissolved in the stomach and allows for release in the intestine. The recommended dosage of serrapeptase can vary depending on the specific health condition being treated. However, the doses typically used in studies range from 10 mg to 60 mg per day. Serrapeptase enzyme activity is measured in units, with 10 mg of enzyme activity equal to 20,000 units. You should take it on an empty stomach or at least 30 minutes before eating or 2 hours after finishing a meal. In terms of supplements, serrapeptase is commonly available as a standalone supplement or as part of a combination formula with other enzymes or ingredients. Combination formulas may be designed to target specific health concerns, such as supporting joint health or promoting cardiovascular wellness. It is important to follow the instructions provided by the manufacturer or consult with a healthcare professional for personalized dosage recommendations. It is worth noting that the dosage may also depend on the strength or concentration of the serrapeptase supplement being used. Different brands or formulations may have different potencies, so it is important to carefully read the product label and follow the recommended dosage instructions provided. Additionally, the duration of serrapeptase supplementation can also vary depending on the individual's health condition and response to the treatment. Some individuals may only need to take it for a short period, while others may require long-term use. Are there any potential dangers or side effects associated with serrapeptase? Serrapeptase is generally considered safe for most people when taken orally or applied topically. However, like any supplement or medication, it can have potential dangers and side effects that should be taken into consideration. Some potential dangers and side effects associated with serrapeptase include gastrointestinal issues such as stomach pain, nausea, and diarrhea. These symptoms are usually mild and temporary. Serrapeptase may also interact with certain medications, such as blood thinners, so it is important to inform your doctor about all the medications you are taking before starting serrapeptase. In rare cases, allergic reactions to serrapeptase have been reported. Symptoms of an allergic reaction may include a rash, itching, swelling, dizziness, or difficulty breathing. Pregnant and breastfeeding women should avoid using serrapeptase, as its safety in these populations has not been established. Additionally, individuals with bleeding disorders or scheduled surgeries should exercise caution when considering serrapeptase, as it may increase the risk of bleeding. Serrapeptase may also increase the risk of bleeding or bruising when taken with garlic, fish oil, and turmeric. Some studies also reported other side effects in people taking the enzyme, such as poor appetite and muscle and joint pain. Overall, while serrapeptase has shown potential benefits, it is crucial to weigh the potential dangers and side effects against the expected benefits and consult with a healthcare professional to make an informed decision. Thank you for taking the time to watch my video. I hope you found this video on serrapeptase informative and useful. By understanding what serrapeptase is and how it works, you can make an informed decision about whether or not to supplement with it. Don't forget to like, share, and subscribe to my channel to stay updated with the latest content. By liking my posts, you show your appreciation for the hard work and effort I put into creating valuable and engaging content. Sharing my posts allows more people to discover my content and benefit from it too. And subscribing ensures that you never miss out on any future updates. Thank you for your support. Until next time.